With this program, we continue the meeting with board-certified ophthalmologist Dr. Alina Kochoumian Stanciu. In our last episode, Dr. Stanciu introduces her aesthetic center. In this second installment, she describes her work in advanced eye care. With over 18 years of experience, Dr. Stanciu discusses numerous eye illnesses and their medical and surgical treatments.
I want to show my patients, and this is what I do when I do an eye consultation and I have to describe a condition of the eye. I use the model eye, and this is a giant eye that I have the ability to open up, and I'm going to go one by one the parts of the eye. This is called the cornea, which is the front of the eye. This is the lens, which becomes the cataract when it gets cloudy. This is the retina, which, as you could tell, has a lot of vessels. Retina, which is the back part of the eye, is the only part of the eye that cannot be replaced. And the center of the retina is called the macula or the fovea. These vessels are an extension of the vessels that are in our body. So if we have high blood pressure, diabetes, or any other conditions that affect vascular circulation, we see it first in the eye because we have the ability to look in the eye and see these vessels directly. This is the optic nerve. This is where all the bundles of nerves take the image from the eye, from the retina to the brain, and that's how we connect with the world. Diabetes is a very prominent condition. A lot of people suffer from diabetes. There are newest approaches to how we treat diabetes in the eye. We don't do lasers anymore so much. Actually, I do laser less than 10% of what I used to do years ago. Now we have injectable intravitreal injections that are used in treating bleeding in the eye, and they're quite efficient. Patients with macular degeneration, there are a lot of advances now in treating and addressing macular degeneration. I've been treating this condition, which is the leading cause of blindness in people over 60, I would say. There are new techniques and new ways of treating this, but again, prevention is very important. Glaucoma, it's another specialty that I have a great interest in treating, experience over the years. And there are two kinds of glaucoma, narrow angle and closed angle. What's new in treating glaucoma? What's new is that, again, the same principle applies here. Early detection is key. You don't want to wait until you have advanced glaucoma to discover you have glaucoma. And how do we detect that? By doing a thorough examination. In my office, we have 3 steps that we do. One is we check the pressure, we do a visual field, and then we have the advanced OCT machine, the Heidelberg, which is very sensitive to early changes of damage to the optic nerve. Glaucoma, it's pressure in the eye that affects the health of the nerve. And when the nerve doesn't work well, then you start getting blind spots and losing sight. So the whole key is to prevent this damage to happen, because if it's detected early and the pressure is checked periodically and is maintained at a level that's safe, and I consider most of the time the safe level to be less than 14. In the past, we used to think, oh, the pressure is 20, up to 21 is normal, don't worry, you don't have glaucoma. That is not true. Every patient is individualized. You have to treat glaucoma individualized for each patient. Some people with a pressure of maybe 15, 16, they could lose eyesight if they have bad circulation. Other patients come with pressures that are like 20, 24. They have no idea they had pressure because glaucoma, it's a silent disease. You don't know about it until it's too late. This is early stages of glaucoma, but that's the whole idea. You want to detect glaucoma early. Diabetics, people with high blood pressure should have their eyes checked more often. Make sure they don't develop glaucoma, because both diabetes, high blood pressure are risk factors for glaucoma. This is how we treat glaucoma. Initially, we start with drops, combination of drops, and then we monitor that pressure. But if that pressure still is up and the patient sometimes can't afford to pay for all these drops, the other alternative is to combine drops with laser. So we do in this office the newest and the latest laser for glaucoma. And in even more rarer situation, when it's a very bad case of glaucoma, surgical approach is also indicated. So glaucoma has 3 levels of treatment: drops, laser, and if that doesn't work, then we recommend a surgical approach. So this is a patient that comes in. We just discussed what the cataract does to the eye. It creates like a film over the eye. As you could tell, this picture looks like it's not focused. Why it's not focused? Because it's the cataract that's making the film over the eye, and we cannot focus very well on the retina. So this is a patient that has a dense cataract, a small hemorrhage in the eye from diabetes, and we check the circulation in the eye, we check the health of the eye. We get a lot of information just by using this wonderful machine, which is called the Heidelberg fluorescein angiography OCT machine. A patient that has a cataract is going to need to understand what a cataract does. It's like a film over the eye that creates a fog, creates glare, and creates poor vision in dim lights or at night, driving at night. All these things affect the ability of a person to function normally. That is the patient complaint. But then my examination will reveal the presence of this cataract. Then I would sit down and discuss with the patient, how do we address this cataract? The treatment for cataract is usually surgery. So we need to make a plan for surgery, which is not a very complicated procedure, but it has to be done in a way where it's a smooth event. If somebody wants to see after cataract surgery and doesn't want to wear glasses, then I offer the newest and the best, which is the multifocal, which we call it like the zoom lens, that corrects the vision, and you don't need to wear glasses for 80% of your activities. But not everybody it's a candidate for this procedure. Some people who have eye problems like glaucoma, corneal disease, retinal disease, which I carefully check before I offer the options to the patient, sometimes they cannot have all these options, so they have to use the regular lens. My lens of choice is usually the AMO Technique lens. It's a very good lens. It gives very predictable visual outcomes after cataract surgery, and does not require stitches, does not require anesthesia, and the procedure, as I said, takes about 10 minutes. The other procedure that I offer to my patients, if they absolutely want to have the laser-assisted cataract surgery, that's the newest approach to cataract surgery, and part of the surgery is done with the laser. Everybody says, why did you go into ophthalmology? And I say, because I find the eye to be the most fascinating part of our body. Not only that is a very complex organ, it has a lot of delicate structures that have to be very carefully evaluated and diagnosed with very subtle signs, and that I love to find things and treat those things. I recommend everybody over the age of 40 to definitely have an eye exam once a year. Diabetics should have their eyes checked once a year if they are well controlled, and if there are any issues, twice a year. Patients with macular degeneration, which is the leading cause of blindness, and I specialize in treating macular degeneration, should definitely be screened early, because early detection will prevent lots of problems and prevent vision loss. So we have a whole range of technology that allows us to do a very thorough and up-to-date and advanced, efficient and professional and complete evaluation of our patients. Preventing vision loss, it's one of the things that I dedicate my profession, and I feel very strongly to help my patients understand what to do to maintain a good vision and to treat their conditions with the newest and the latest technologies in addressing certain conditions that I specialize in.
The Advanced Eye Care Clinic of Armenian ophthalmologist Dr. Alina Kochoumian Stanciu is happy to take care of all your eye and vision medical needs. To make an appointment, please use the contact information on your screen.